My name is Doug Nices. I'm from Elkton, South Dakota, and I work at Baby Bell, the new cheese place here in Brookings. I came to the ER and with a stroke, and I didn't know that I was having a stroke. I was at work, and then I was just visiting with the other employee, or actually my boss, and in between sentences my voice changed, started rambling, and I thought, that's really weird. I wonder why I'm doing that. And he works at the ambulance in Elkton, and he's like, dude, you're having a stroke. And I'm like, he said, do you feel good? And I was like, I was trying to tell him I feel great. I was standing and like marching, like showing him that I didn't lose any of my strength and stuff, but I couldn't stop rambling for like 5 minutes or more. I just blah, 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 blah. So then that's why we came to the ER right away. When I came in then, I had great service, and they were very fast, and they had to do a lot of testing because I was running a 104.5 temp, which is kind of odd. So I think they were trying to figure that out, why I was running such a high temp, because that's not normal for a stroke. They did a CAT scan and stuff, and then they were like kind of figured out what's going on. I did my rehab, and they did a great job. You know, when I had my surgery in Sioux Falls, they said he's probably not gonna walk or talk again. That was 4 months ago. At that time, you know, I couldn't walk or talk and stuff, and Amy's helped me out a bunch, and my first word was yep. But after, it took maybe a month or so, and I was putting sentences together, and stuff started to happen for me. And so they had on the table, and this was with Amy, so I was already back and like kind of back into normal life kind of. And Amy had on the table, she had a glass and a rose and a toothbrush and matches, and there's like 5 things. And they asked me, my wife had it on video, so I watched it, and they asked me, can you point to the rose? I had no clue. I kept looking in the cup, and couldn't answer any of her questions of what it was. And then she did really simple things like, do you know where the door is? And I'd look around the room and couldn't figure out, where's the wall? No clue. Where's your chair? No clue. And so it really made me realize that I was not thinking straight. The way I understand, I have a year's time to get back what I'm gonna get back. It's in a year's time. So that's my deadline. So I'm pushing really hard I really want to start to spell good again and read good again. So those are the things I'm doing a lot of now, because I don't want to lose it if I don't have to. So I'm still working on that kind of stuff a lot. And I'm remembering pretty good things. I think last time I can remember, like, if you give me a list of like maybe 10 things to do, I can remember it without writing it down. And a lot of people can't remember that anyway, so they say I'm doing good. The people are all super nice, like super nice. I've become really good friends with a lot of them. They mean a lot to me now. They're not just people anymore. They're friends. I recommend Brookings Health System because the care was great, and you know, like the doctor said, I was probably one of his most unique situations when I came here, and he had to do a lot of thinking fast, and he did, and it probably was part of the big reasons why I made it, because he thought fast, and so I think the care was great here, and I think the ER thought fast and did what they had to do and stayed calm, because of course we weren't, and they stayed calm and handled the situation and did a great job.